How high does your blood pressure have to be to trigger a stroke? This isn't just a medical question, it's a life or death issue for millions of people living with high blood pressure every day. Hypertension has long been recognized as the leading risk factor for stroke, a medical emergency that can cause permanent disability or even death if not treated in time. Many of my patients, often vibrant seniors just like you, come to me with a common misconception. They believe that if they feel fine, if they have no headaches or dizziness, then their blood pressure must be okay. This dangerous idea, this quiet assumption, is precisely why high blood pressure has earned its chilling nickname, the silent killer. Imagine a tiny crack in a grand old dam. It starts small, almost imperceptible. You might not notice the slow, steady drip, drip, drip of water, but over years that tiny crack silently widens, eroding the integrity of the structure until one day, without a dramatic tremor or a loud warning, the dam gives way. This, my friends, is exactly what high blood pressure does to the delicate blood vessels in your brain. It's a relentless, unseen force working 24 hours a day, 7 days a week, slowly, insidiously, weakening the very lifelines that deliver oxygen and nutrients to your brain cells. And the most heartbreaking part? You often don't feel it until it's too late. The frustration, the worry, the eventual shock when a diagnosis of stroke comes. It is a scenario I have witnessed far too often, and it is entirely preventable if you know the secret numbers and how to act on them. Let's consider Margaret, a woman I'll never forget. She was a vibrant 71-year-old, a retired schoolteacher who loved her weekly bridge game and tending to her rose garden. Margaret felt healthy, active, and full of life. She had her annual checkups, and her doctor would occasionally mention that her blood pressure was a little high, perhaps 140/90, or sometimes even 150/95. But Margaret, like so many others, would often dismiss it. "It's just age, doctor," she'd say. "I feel perfectly fine." No symptoms at all. She saw friends taking multiple medications for various ailments and felt lucky that she wasn't bogged down by constant pills. She assumed that since she wasn't experiencing dramatic spikes or feeling unwell, the little high readings were just a minor inconvenience, not a ticking time bomb. She'd forget to check her blood pressure at home, convincing herself that if it truly mattered, she'd feel something. This went on for years, this silent erosion, this gradual weakening of her internal pathways. Then, one Tuesday morning during her bridge game, her hand wouldn't pick up a card. It felt weak, numb. Her friends noticed her smile was uneven. Her speech became slurred. Panic set in. Margaret was having a stroke. The ambulance arrived, and in the emergency room, her blood pressure was a staggering 190/110. It was a hypertensive crisis, the culmination of years of silently elevated pressure. What Margaret didn't know, what she had been unknowingly ignoring, was that her little high blood pressure had been creating a catastrophic vulnerability in her brain for years. Her story is a poignant reminder that feeling fine is not the same as being fine when it comes to blood pressure. The hidden danger isn't always a sudden event. It's often the slow, silent damage that accumulates over time, making you incredibly susceptible to a life-altering event. Now, for the key insight, the revelation that can truly empower you. What exactly are those dangerous blood pressure levels that Margaret unknowingly navigated, and how do they lead to a stroke? The medical community, including the American Heart Association and the American College of Cardiology, defines hypertension as a systolic blood pressure, the top number, of 130 millimeters of mercury or higher, or a diastolic blood pressure, the bottom number, of 80 millimeters of mercury or higher. But here is the critical, often overlooked secret. Your risk of stroke and silent damage to your blood vessels actually begins to increase continuously above blood pressure levels of approximately 115/75 millimeters of mercury. Think of it this way. 120/80 is often considered normal. But once you cross into that gray area, even slightly say to 130/85, your blood vessels are already feeling the strain, working harder, enduring constant, low-level trauma. This isn't a sudden dramatic explosion. It's more like a relentless river carving away a canyon, slowly but surely reshaping the landscape. And then there's the truly urgent level, a hypertensive crisis. This is when your blood pressure reaches 180/120 millimeters of mercury or greater. At this point, the alarm bell should be deafening, because a hypertensive crisis is a medical emergency that significantly increases your immediate risk of a stroke, a heart attack, or other life-threatening conditions. This is the moment the dam is truly about to burst. So, how does this relentless pressure translate into a stroke? There are two primary ways. The first is an ischemic stroke, which accounts for the vast majority of cases. Imagine the intricate network of blood vessels in your brain like a complex system of pipes delivering water to every room in your house. When your blood pressure is consistently high, it's like having the water pressure turned up too high all the time. This constant force damages the inner walls of these delicate pipes. Over time, this damage leads to a condition called atherosclerosis, where fatty deposits and plaque build up on the damaged vessel walls. These plaques narrow the pipes, making them stiff and less flexible. Eventually, a piece of this plaque can break off, or a blood clot can form right there, completely blocking the flow. When that happens in a brain artery, the part of the brain fed by that artery starves for oxygen and nutrients, leading to an ischemic stroke. It's like a clogged pipe shutting off the water supply to a critical part of your home. High blood pressure also damages the very tiny blood vessels, leading to what we call small vessel disease and tiny, lacunar strokes that can accumulate over time, often unnoticed until cognitive function starts to decline. And there's another connection. High blood pressure can also contribute to an irregular heartbeat called atrial fibrillation, or IVFib. In a FIB, blood can pool and form clots in the heart, and these clots can then travel to the brain, causing an ischemic stroke. The second type is a hemorrhagic stroke. This is less common but often more deadly. Here, the problem isn't a blockage but a leak. That constant, high pressure we discussed earlier doesn't just damage the pipes. It can weaken them over time, making tiny bulges or microaneurysms form. If the pressure surges too high, or if these weakened spots simply give way, the blood vessel can rupture, spilling blood directly into the brain tissue. This bleeding causes direct damage and pressure on the brain, leading to a hemorrhagic stroke. Think of it like a worn-out garden hose bursting under pressure, flooding the surrounding area. So whether it's a clog or a leak, the root cause is often the same: uncontrolled, persistently high blood pressure. The secret here is that you don't need to be in an acute crisis for damage to occur. Even moderately elevated blood pressure, what Margaret considered just a little high, is constantly assaulting your brain's vital blood supply, setting the stage for a stroke long before any noticeable symptoms appear. This is why knowing your numbers and understanding their implications is not just important, it is absolutely critical. But here's the empowering news: you are not helpless. You have the power to turn the tide, to reinforce that dam, and to protect your brain and your future. It begins with a simple, 3-step protocol that you can start implementing today. First, know your numbers, and I mean truly know them. Invest in a reliable home blood pressure monitor. Take your readings regularly, at the same time each day, usually in the morning and evening. Log these numbers. Don't wait for your annual checkup. High blood pressure is too sneaky for that. This consistent monitoring is your personal secret weapon against the silent killer. Second, talk to your doctor with purpose. Bring your blood pressure log with you. Discuss a personalized target for your blood pressure, which for many seniors aiming to prevent stroke, should ideally be consistently below 130/80 millimeters of mercury, if tolerated. Your doctor can help you understand if lifestyle changes alone are enough, or if medication is necessary to safely and effectively bring your numbers down. Do not ever arbitrarily stop or change your medications without consulting your healthcare provider, even if you feel fine. Remember Margaret's story. Third, embrace simple, powerful lifestyle changes. This isn't about drastic, unsustainable overhauls. Start small. Adopt a heart-healthy diet rich in fruits, vegetables, and whole grains, like the DASH diet, which focuses on reducing sodium and increasing potassium. Aim for at least 150 minutes of moderate-intensity physical activity each week, something as simple as brisk walking. Maintain a healthy weight, limit alcohol, and if you smoke, please seek help to quit. These actions aren't just for your heart. They are profoundly protective for your brain. They are the tools to put out the fire and repair those pipes before the ultimate damage occurs. Imagine waking up each morning with renewed energy, with a clarity of thought you haven't experienced in years, knowing that you have actively taken control of a hidden risk factor that threatens millions. Imagine the peace of mind in knowing you have proactively protected your brain from the devastating effects of a stroke. This isn't a dream. It's a future you can build, starting today, by understanding and acting on your blood pressure numbers. If you or someone you love experiences sudden facial drooping, arm weakness, or slurred speech, remember the FAST acronym and immediately call 911. Time is brain. For more life-saving advice to help you live a longer, healthier life, subscribe to Senior Forward Health. Your proactive steps today are the building blocks for a healthier, more vibrant tomorrow. Take control. Stay informed. Live well.